Hello and welcome to the Third Sector. I'm your host, Tamara Brinkman. In our society, there are three sectors: the public, the private, and the nonprofit, and it's that third sector that we're here to talk about today. Joining me on today's show are going to be Rachel Hughes. She's the executive director of the Model T Ford Club. And then later in the episode, Carrie Meyers from the Neighborhood Health Center will be joining me. First up, though, is Rachel. We want to welcome Rachel to the show. Thank you very much for joining us.
No, you're welcome. Thanks for having me, Tamara.
Well, so for some of you regular viewers, longtime viewers out there, this is a little flip of the tables. So for, I think, most of the years that the show has been on the air, Rachel was in this seat and was the host. And so we're kind of turning the tables now, where that has changed in some time, and now she's here representing as the executive director of Model T Ford Club and Museum here for Richmond, Indiana. Did I get that right or close enough?
You did. You did. Yes.
Well, so with that, Rachel, why don't you just, diving right in, tell us about the history of the club and the museum, how long they've been here in the community.
Sure. Before I do that, I want to thank you for taking over the third sector. When I decided it was time to retire, I can't think of anyone better to do it, and you're just doing a great job. So thank you for stepping into that role.
Well, thank you very much for thinking of me and having the confidence, because I'll tell you, it has been, it's taken a long time to find any stride with it. Every time the nerves, the like, oh my gosh, so it's an adjustment, but it's been fun.
You're doing great. So just hang in there.
Thank you. Thank you so much.
I think the one thing that most people don't realize about our organization is that we are actually an international membership organization. Everyone sees the museum here, but what they don't realize is that it is operated by an international membership organization that has around 5,000 members all over the globe. And that's pretty exciting to me, to think that right here in little old Richmond, we have this wonderful membership organization made up of people from all walks of life with one passion, and that is the Model T. And there's so much behind the Model T, more than just this funny little car that we see driving around Richmond. But this organization was actually started in the 60s. So we have been around a very long time. It was incorporated in California, and in fact, we are still considered a California corporation. But our main headquarters is right here in Richmond now. And often get the question, why in the world is a Model T museum in Richmond, Indiana? And it's really kind of a fun story. Our founder, Jay Clayfoth, who unfortunately passed away last year, was an executive with Ford. And when he decided it was maybe time to slow down a little bit, he wanted to move back home, which was Wayne County. And he had a collection of Model Ts. And he just loved his Model Ts, and decided that it would be fun to have a small museum dedicated to the Model Ts. So the actual first museum was Jay's collection. And I believe there were maybe 4 or 5 Model Ts in that first museum. And that was, if folks maybe recall that was located over on I-70, where the Warm Glow company is now. And we were in a small building there. Then when Warm Glow decided to expand, they needed that space for their expansion. And that's when we expanded over here, moved over here to Richmond, and bought this building down here in the Depot District. And it's just really been a godsend to us to have been able to purchase this building with the help of a lot of people that came alongside of us. And then the volunteers. I just can't say enough about the volunteers, because without them, we couldn't exist here. They came along, they did the drywall, the painting, the plaster work. They cut wood, they sanded wood, they put it up. and just made this into a really neat museum.
Mm-hmm.
Well, that wasn't enough because we just started getting more and more and more cars, and we had cars in storage that we couldn't display.
Mm-hmm.
So we
And
bought another building.
we're putting some pictures up while you're talking of the cars and some of the guys
Fabulous.
doing some of the construction work. And I think we saw a picture of what would have been like a couple of the mechanics maybe doing some work. And so lots of pictures that you sent us we're showing right now for the viewers too. So you know, because I don't think you can see those.
I can't see them.
Yeah.
So that's fabulous because I want people to get credit for what they did by turning this basically vacant warehouse into the museum. And we grew so much, we were renting a building across the street. And another thing I don't think people realize is that we actually have two buildings in the museum now. So we started on a campaign to purchase this building, and we were able to do that a few years ago. So now we have two beautiful buildings full of amazing cars. If you've not seen any other Model Ts except the ones you see kind of running around the streets, you really need to stop in here because we have what they call the brass era cars. So you're probably used to seeing the little black Model Ts that really are just black. But there's a whole nother era of Model Ts that have brass on them. And these are gorgeous vehicles. The very early ones had brass on them. They are fabulous cars. We also have a Model N, which was a forerunner to the Model T. Yeah, Henry wasn't real creative with his names, you know, it was ABC. And we also have a Pete and Pole airplane that has a Model T engine in it.
Oh, wow.
So there's a lot to see in these two buildings. We actually have around just over 40 vehicles and an airplane.
They just showed a picture of the airplane.
Yes.
Yeah.
It's amazing. You know, people keep saying, did you fly in it? Well, no, I didn't fly in it because it's been in the collection a long time. But I often pause and think, you know, the way my Model T runs, I'm not sure if I want to go up in an airplane that has that kind of engine in it. But a lot of people did. Now, a lot of people flew in this airplane. So backing up just a little bit, I get so excited I want to talk about the cars. But backing up, the club then came behind this museum and helped it grow into what it is today. But Jay was the founder of the museum back all those years ago.
Wow.
So it's a pretty amazing place, and I just can't say enough about it. Since they're putting pictures up, I want to talk about a couple other cars if I could before you ask me another question.
Sure.
A couple of the really fascinating vehicles and things that I think people would love to come and see. We have two fire trucks, but the one is simply amazing. It has gold leafing on it in the pinstripes. It has been beautifully restored. It has ladders on it. And we have a little down.
That's up on the screen right now as you're describing it. They just got that picture up on the screen of the fire truck.
Yes.
Yeah.
That was, I believe, one of the first vehicles that was donated to us after we moved into the buildings over here. Kind of our pride and joy, because you just don't see a lot of Model T fire trucks. But I think when people think about Model Ts, they think of the funny little cars. They don't realize that there are Model T fire trucks, trucks that have been converted to fuel trucks, wreckers, ambulance. There were so many more things that they could do with this little Model T. It was such a versatile vehicle. We also have the concession truck, and I believe I sent you a picture of that. It's one of the most fun vehicles we have, I think. They have actually converted it into a food truck, what we would call a food truck today.
So before food trucks were food trucks, there was Model T food trucks.
Yes, built on a Model T chassis. We call her the purple cow because she actually has stained glass, and there are purple cows in the stained glass.
Oh,
So, so especially the
affectionately.
kids love that.
Oh, yeah. How fun. So, one of the questions I have for you is how is the organization, how are you guys funded? How do you fund the work that you do? How does the museum fund its ability to keep its doors open?
That's been a real challenge during COVID
Yeah.
because we are
Okay.
we are funded
Thanks.
through admissions to the museum,
Okay.
sales in our gift shop, and then grants and gifts from folks in the community, excuse me, and outside the community. So many of our members in the club support the museum, as well as community members right here in Richmond, Wayne County.
Mm-hmm.
Before COVID, a lot of our support was through admissions and gift shop sales. And of course, we have been devastated by COVID.
Mm-hmm.
Prior to the pandemic, we would see between 4,000 and 5,000 visitors annually in the museum. That has dropped to under 1,000 right now. And we know that will come back. But right now, it's a real struggle. I will tell you that it's a challenge, and we're trying to be creative in our fundraising and look for grants that we haven't previously applied for. We also reach out to the members in the national club, and they have been great to respond. They really have, because they have a passion for the Model T and really want to support the museum with their gifts each year.
Right. Well, I can certainly say I've had the pleasure, I've only been to the museum once, and I did not know that there were two buildings, and it is quite an amazing sight to see all the cars, everything that you have there, the history that's behind it, the airplane, the fire truck. It's really a lot of fun. I would certainly encourage anybody who hasn't been there, if you are able to get there, please do, because you'll really enjoy it. As we're wrapping up here with the last minute or so, Rachel, for folks that might be watching this episode and hearing all about this and want to get involved, maybe volunteer or even donate, we have been putting up some website address information and telephone number. What's the best way for them to connect with you to do that?
The best way is just give us a call or stop in.
Okay.
Currently, we're on our winter hours, so we're open Thursday through Sunday, 10 to 4.
Okay.
Just, pop in if you want, have a chat with us. It's really, really inexpensive to come to the museum, or give us a call. We'd be happy to talk with you. The number is 765-488-0026.
Perfect.
And you can always visit our website, kind of browse around. There's a virtual tour. You can check that out too.
Oh, how fun. Well, we got that number up on the screen there for our viewers as you were verbally giving it to us. So hopefully anyone that's watched this that wants to connect with you can reach out and definitely take advantage. Get out, go see it, take your kids. It's a fun place. It's really neat. And so, I just encourage anybody out there to take some time and check it out. That wraps up our time with Rachel today. Thank you so much, Rachel, for joining me and sharing all of that wonderful information and history about Model T Ford Club, Museum. And when we come back, we're going to have Carrie Meyers from Neighborhood Health Center joining us. Stay with us. Welcome back. Carrie Miles is joining me now, and she is the CEO of Neighborhood Health Center. There's Carrie. Carrie, hi. Thanks so much for coming on the show.
Hello, Tamara. How are you?
I am doing well. Thank you. Thank you so much. Excited to have you on the show. Excited to hear about Neighborhood Health Center. I will just mention for our viewers, they have two locations. We have one here in Richmond, and there is also one in Liberty. And we're just putting some address and phone information up there. So as Carrie starts to share with you all the wonderful information about this organization and the services that they are able to offer, a lot of our most vulnerable and those in need in our community, you can know that there's 2 locations. So, spread the word. So with that, Carrie, why don't you just give us a little bit of information about the Neighborhood Health Center? How long has it been around? How did it come to be here in our community?
Yeah, thank you. So Neighborhood Health Center, we were established in 2017, really looking at the needs of our community. So we realized that there was incredibly high need in regards to clinical service and some of our socioeconomic challenges that our community faces. So we were established in 17 and opened our first clinic in Richmond in 2018. And right down here on South A and 10th Street. So we began serving those patients. And we were originally started with 1 clinic and 1 provider and have quickly grown into 2 locations and now 10 providers. And we provide primary health care as well as mental health services, access to dental. We also assist with financial help and transportation assistance and medication assistance and a variety of other things that our staff are really resourceful and help our patients take care of. So we've grown quickly, and we've really been excited to try to meet some of the needs that we've seen come up in our communities over the last few years.
Mm-hmm. So what would you say would be, or if you could say, the mission, or is there a vision that you guys are working towards, or?
Yes, we are looking to improve the health and wellness of our community. And that's a pretty broad definition, but really looking at care, healthcare in a holistic perspective. So not just your physical needs, but also your mental needs, your dental needs, your just taking care of life needs. And we provide care for patients regardless of the ability to pay. So we are here to serve folks who live, in low income, in high poverty situations, and have the resources available to help them from a financial perspective, meet those needs and get the care that they need.
Mm-hmm. So while you've been sharing some of that information, we put the website up for some folks to see, and we also saw a picture of, like, an exterior picture on a beautiful blue sky background of the health center located here on 10th and South A.
Mm-hmm.
So what would you say are, or do you have, like, your goals for just maybe the next year? Or if you have something that's a little more long-term you want to speak to?
Sure, absolutely. I think with the calendar flipping over into a new year, that's the time when we really start talking about, what do we want to accomplish in 2022? And, that really comes down to improving the quality of life of our existing patients, and then also expanding to meet the needs of new patients.
Mm-hmm.
We've been incredibly blessed to welcome a lot of new patients in 2021. We've added almost 1,400 patients in 2021, and look to continue that growth in the next year, but also making sure that we increase access to mental health services. I think that has really, certainly with the pandemic, has highlighted the needs for that mental health component. It's a challenging time for all of us, and just making sure that we have the providers and the resources available to meet those needs. It's a continual challenge because of the needs and the limitations of providers, but that's really at the top of our list is to make sure that we have those resources available, counseling services, but also diagnostic and medication.
Mm-hmm. What are you guys seeing as the biggest needs, maybe top 2 or 3 that you just are a huge need for our community?
I would have to say mental health is probably number 1, but also just that financial component. I think we have so many people in our community who are functioning at trying to, make decisions about whether they pay the electric bill or they buy their prescription medications. We've had a lot of changes in workforce, in this community over the last couple of years with the pandemic, and the financial needs have continued to grow, exponentially as we've gone on.
Yeah, yeah. So you guys are newer into the community, as you mentioned. So with just being here for a short period of time so far, what would you say, what would happen if Neighborhood Health Center wasn't here in Richmond? And that may just be looking back to the years before it was here, but certainly a lot has changed in the short time that you guys opened your doors in our world. And so I'm just curious, what happens to us if we don't have a neighborhood health center?
So in 2021, we served 5,000 patients between the two locations. So for those 5,000 patients, they're looking to find healthcare elsewhere, and that's certainly a challenge. We've seen a lot of the new patients that have come on board in the last couple of years have not accessed healthcare for an extended period of time because there were just limitations in their life. Maybe that was an access issue, maybe it was a financial issue, potentially just the fear of going someplace. So we've prided ourselves on creating that relationship with those patients, and our staff are incredible at making those connections and really understanding the patient beyond their clinical needs, so what's going on in their family that might be, limiting them in terms of where they want to go in their health and wellness. So, I think certainly those 5,000 patients, and then just the loss of what future patients could come to us is really what's at risk.
Yeah, yeah. So when you have seen that, people coming in that had gone long periods of time, maybe without any, having had any health care or doctor's appointments, is that across all age groups and demographics, or are you finding that it's more with older folks or some of the younger ones, or, how are you seening that unfold?
I think it's all ages. I think
Okay.
it's infants all the way up through the lifespan, and all demographics. We really have had a tremendous growth with serving the Latino population. So we were fortunate and blessed. We were awarded some grant funding through the Wayne County Foundation, and used those funds to hire a certified medical translator. And she started with us right at about a year ago, and her numbers and her volume of patients that she's able to bring in and provide that translation has just, more than we could have ever imagined. I've lived and worked in this community my whole life, and I never imagined that there were that many patients who were not accessing health services.
Right.
And, we still have a lot of work to do. It's created a lot of downhill challenges. How do we communicate with those patients when our interpreter is not here? So we've added a bilingual nurse that's helping those patients, and translating all of our documents, our website. We're actually in the process of building a new website, and it will be bilingual.
Wow.
Our Facebook and our social media, all of those things, how we live and breathe is in English. And for a segment of our population, English is their second language, and not a very strong language. So,
Right.
I think that has been, one of those projects that you don't really anticipate, but it has grown dramatically.
Well, good work meeting, answering the needs of the community and being able to figure out how to provide some supports to meet the needs of the folks where they're at. With that, so you mentioned just briefly, you touched on the staff, right? Bringing in the bilingual and the nurse and the other worker. Tell us a little bit more about the staff as a whole overall. What's an overview of it?
Yeah, so we have about 50 employees between the two locations.
Okay.
And those range from, support staff in the front office, so the ones that are the voice and the face of the practice, the clinical team, so the medical assistants that work with the providers, as well as financial and billing support, IT work, marketing. One area that we really grew in 2021 was our outreach. So we, again, we're fortunate to receive some grant funding and purchased a mobile unit, a mobile van. So we're able to go into the community and be a part of community organization events, health fairs, provide on-site care. Those are all things that we are really looking to grow in 2022, and to take the care where it needs, into the
Right.
community. So, we've got a really eclectic staff and group, but they are all patient focused, regardless of their roles.
Yeah.
They're always thinking about the patient.
So I have a question for you. How do you guys get funding? How does that work? Particularly as you mentioned, you're helping a lot of folks who aren't in a position to be able to pay or have some type of, financial challenges.
As a community health center, we receive higher reimbursement from Medicare and Medicaid. And that higher reimbursement allows us to provide care for those individuals who can't afford their care. So by and large, most of it is public funding, but we also take commercial insurance. So for those who live and work full time and have commercial insurance, we accept those plans. We also receive grant funding, so federal as well as state and then local grants for various projects and programs that we want to expand into.
Okay, well, that's very good. We have been putting up information while you've been sharing and with us today. Your website, phone number. Again, we put up the addresses of both the locations, Liberty in Union County, and then obviously the Richmond location here in Wayne County. As we wrap up with these last just 30 seconds, really quick, what's the thing you love the most about what you do?
Gosh, that's really hard. You're putting me on the spot. I think just that the day-to-day interactions that we have as an organization with our team members, with our employees, and those interactions that the employees have with our patients, it's really special.
Right.
It's been incredibly fulfilling to see that lived and breathed every day.
Yeah, that's wonderful. And thanks so much for that. As we wrap up this episode of The Third Sector, I'd like to thank my guests, Carrie Meyers, CEO from Neighborhood Health Center, and also Rachel Hughes, Executive Director of Model T Club and Museum, for both of them for joining me today and sharing all about what it is that their organizations do to support and help our community. Thank you so much for joining us. Stay well, and we'll see you next time on The Third Sector.